So you want to learn about coronary artery disease. Let's get started. Food. We love and need it to survive. The fun part about food is we have such a variety of choices we can eat. We all have cravings to eat the unhealthiest of foods sometimes. However, things like fried food, fast food, processed meats, and desserts all contain high amounts of unhealthy cholesterol. And why is this a problem? There are two main cholesterols we will talk about today. LDL stands for low density lipoprotein. Let's call this the bad cholesterol. This type of cholesterol travels to your tissues through the bloodstream. The food mentioned previously can increase your LDL levels. HDL stands for high density lipoprotein. Let's call this the good cholesterol. This type of cholesterol removes excess LDL in the blood and takes it back to the liver to be broken down and removed from the body. LDL is needed to build cells and make vitamins and hormones, and the liver is where it is naturally produced. However, excess LDL from the food we eat can lead to the narrowing of arteries. Foods like eggs, cheese, shellfish, and unprocessed meats are foods that can lower your LDL levels. And here are the coronary arteries. We have a left and right. The coronary arteries are the main supply of oxygenated blood to the heart. Now, this is an example of a healthy coronary artery. If the body has more LDL than HDL, then the HDL cannot remove the LDL from the arteries properly, which leads to a buildup of LDL in the arteries. The LDL combines with fat and other substances in the blood and creates a waxy-like substance, plaque. Plaque collects in the arteries over time, narrows and hardens the arteries, leading to inflammation. This is called atherosclerosis. During this stage, symptoms like angina pectoris, which is chest pain, can occur, as well as shortness of breath. Now, this is an example when plaque has narrowed the coronary artery to the point where blood can no longer pass through. This leads to myocardial infarction, a heart attack. A blockage to the coronary artery can also occur from plaque that has been broken apart or ruptured. Platelets come to repair the artery and form blood clots.
Before moving forward, it is important to understand the circulatory system. This will allow us to understand why the coronary arteries are so important for heart function. First, deoxygenated blood enters the inferior and superior vena cava into the right atrium. Next, the blood passes through the tricuspid valve into the right ventricle. The blood then goes through the semilunar valve and through the right and left pulmonary arteries to the lungs, where the blood gets oxygenated. The oxygenated blood then enters the left atrium, passes through the mitral valve, and then enters the left ventricle. The blood then passes through the aortic valve on its way to the aorta, and then is delivered to the body. Coronary artery disease affects the blood vessels that supply oxygenated blood to the heart muscle. The two major coronary arteries branch off of the aorta. When plaque builds up and narrows these arteries, this is when problems start to arise. While food intake that increases one's LDL levels is a main factor in causing coronary artery disease, there are many other factors that contribute to a person being at high risk. These factors include high blood pressure, family history of heart disease, diabetes, smoking, obesity, and lack of physical activity. Most of these predispositions can be helped by a person making changes in their lifestyle.
Now that we have learned all about coronary artery disease, we can talk about what you can do to prevent the disease. A big part of prevention for the disease is your diet. Eating very heart-healthy foods like vegetables, legumes, and oily fish is a great start. Supplementing fruits and nuts as a snack rather than processed sugars is a great alternative as well. It is also helpful to avoid eating red meat. White meat, such as chicken, is a good replacement. Ensuring that you are eating foods with low LDL levels and high HDL levels is key. Another important factor to prevent coronary artery disease are your exercise levels. Staying active throughout your life through endurance training and cardio is super important. Even small changes like taking the stairs instead of the elevator or parking at the end of a parking lot instead of at the front are good alternatives to incorporate more exercise into a busy lifestyle. A healthy body mass index, more commonly known as BMI, is very important for a wide variety of reasons, and preventing CAD is a big one. Eating healthy and exercising regularly are two great ways to help cut down on plaque buildup in arteries, which we previously learned can lead to coronary artery disease. Another important thing to note is that we all live stressful lives. Having a healthy outlet for daily stresses is extremely important. This can be helped through yoga, meditation, or even confiding in a trusted individual. Whatever works for you personally, it is important to lower the amounts of stress that you feel daily. Lowering stress and exercising also helps with lowering blood pressure levels. When blood pressure is very high, this hypertension can really wear out your arteries and progress to the development of coronary artery disease. We already know that there is good and bad cholesterol, and a high blood pressure with lots of bad cholesterol in the blood is not a good thing. It is important to note that all of these preventative options are intertwined. Making small changes in your daily life to work towards an overall healthier lifestyle is really important for the prevention of coronary artery disease. Things like not drinking excessive alcohol and quitting smoking are other ways that you can prevent the disease as well.
So, what if you or your loved ones were to ever be diagnosed with coronary artery disease? Well, there are two main categories of treatments, which is one, lifestyle changes, and two, medications and medical procedures. Lifestyle changes is very similar to what we talked about in prevention. As for medication, we have cholesterol modifying medication. It reduces LDL, as we mentioned earlier. We have aspirin, which is a type of blood thinner to prevent blood clot, beta blockers, calcium channel blockers, and ranolazine, which all function very similarly, in which they decrease heart rate and blood pressure to decrease oxygen demand of the heart. Nitroglycerin, which dilute the patient's coronary artery temporarily and to reduce chest pain. Angiotensin converting enzyme inhibitors and angiotensin 2 receptor blockers, which both decrease blood pressure to prevent CAD from progressing. And as for medical procedures, we have angioplasty and stent placement and coronary artery bypass surgery. Angioplasty and stent placement is a procedure in which a narrow tube inserted with a deflated balloon is inserted into the narrowed coronary artery. Once inserted, the balloon is then inflated and often left in the artery to keep it open. Many stents also release medications over time to keep the arteries open. And as for coronary artery bypass surgery, it is usually performed when a patient has multiple narrowed coronary arteries. A graft is created using a vein from other parts of the patient's body in order for blood to bypass the blocked or the narrowed coronary arteries. And that's it. Now you've learned a lot more about coronary artery disease. Don't forget to share it with your friends and family as well.